I'm Dr. Mustafa Sulemanji, a neonatologist partnering with Ponea Health Care, and we are talking about jaundice in children. So most mothers will have this question as how can I monitor jaundice in my newborn? Well, for you to respond to this question, one, if you are an experienced mother, you will definitely know whether there is a little more yellowness in this baby as compared to the previous baby. But we may have mothers who are first-time mothers and they have absolutely no idea as to how much of yellowness is yellowness. And as I insist and recommend a lot of the parents is that visualizing jaundice with the naked eye is not very reliable, it is not accurate, and it can be extremely misleading. But if you do suspect that your child looks yellow, whether it be the white of the eyes or when you press on the skin for 1 or 2 seconds and you see a yellow tinge on the skin around the chest or at the area of the umbilicus or on the hands or the nails, and you feel that, well, there could be an aspect of jaundice in my baby, then what I'd recommend is you seek medical advice. Because you may come across someone who is a lot more experienced, who knows exactly how to scale the level of jaundice and accordingly manage your child. Most times, it's a very simple blood test that results within a couple of hours to actually tell whether your child has jaundice or not. And if you do it at the right time, then the chances of any poor outcomes or consequences that are significantly serious and can potentially impact your child can be managed in a timely manner. As I said, not all jaundices are problematic or are what we call pathologic. However, there are certain times and there are certain levels of jaundice whereby it is a red flag and it needs to be addressed right away. So, for example, if you're a mother and you've just given birth and you see yellowness in your child within the first 24 hours, for example, that is a significant sign of pathologic jaundice. That is a jaundice that needs to be looked into, to be quantified, and to be addressed right away. If at all the physician or the medical personnel has seen the baby and they have measured the level of jaundice. So if we see that the serum bilirubin or the serum jaundice level is about 15 milligrams per deciliter, then that can be a sign of pathologic jaundice. If the rate of rise in the increase of the jaundice level is above a certain level, then that can be a sign of the jaundice actually being pathologic. The one other sign that constitutes a very significant marker of telling doctors whether the jaundice is pathologic could be the direct caution of the jaundice. So when we're talking about jaundice and we're talking about bilirubin, which is the pigment that causes jaundice, there are two forms of the bilirubin. There is what we call indirect bilirubin and direct bilirubin. And when direct bilirubin is about 2 milligrams per deciliter in a newborn, then that actually constitutes a red flag sometimes. But it is obviously assessed and examined in addition to other signs and symptoms that your baby may have. Depending on the mother and the father's blood group, depending on whether there is a history of a previous child having jaundice, depending on the current clinical situation of your baby. The way we evaluate and the way we assess jaundice may actually differ. Hence, the need for any suspicious yellowness in a baby to immediately be seen by a medical personnel. Thank you for joining us for this discussion today. You can book for our services at ponea.com, and I look forward to seeing you again soon.